Welcome back. We are on week 8 of our stretching program. So you'll need 2 blocks and a bolster and even keep a timer handy. So let's start with our first. Take your bolster behind you. Have the tip pressed up right against your lower back or your sacrum. And then you have your 2 blocks. They're going to go on your sides. Now, it's okay to do this without the blocks as well, but sometimes when we have really tight hips, having the blocks will make us last in the pose much longer. So we're going to lie down. So what you're looking for here is to feel like there's this elevation in the chest, an ability to expand it. Sometimes the head doesn't feel so comfortable without a bit of neck support, so that neck support can be a blanket or even your hands. The blocks, place them on your sides. If you need much more support, bring the blocks closer to the hips. If you need a little bit less support, take them closer to the knees and adjust their height. Just find the right setup. You still want to feel that there is some level of intensity in your hip opening, but just that there's this feeling of contact on the body, and that contact gives your system the sense that you're safe and you can stay longer. So your hands, if you're not going to place them underneath your head, I recommend you to put them towards the floor behind you. If that's really uncomfortable for the shoulders, just have them more stretched out on the sides. And this is our pose, Supta Baddha Konasana. Let's put a timer. We'll keep it to 2 minutes, but this is one of those postures where you can easily be here for 4 minutes or even 5. So let's get into it. Close your eyes. And let's practice abdominal breathing. Inhale and let the abdomen rise up without really forcing it, but just knowing that as the lungs expand, the diaphragm comes down, the abdomen will naturally want to also lift. And when you exhale, feel it naturally sink. Diaphragm presses up into the lungs. It compresses the lungs, and there's that natural recoil of the lungs for air to come out. Repeat that process of breathing into the abdomen and breathing out, letting gravity pull the things down. The natural process of your body to encourage that easy breathing, but effective breathing. As we lay here, I want you to check how your face feels. It's quite common, we'll be clenching our jaw, maybe pinching our lips together. Just check that that's not the case. Try to relax the jaw. I like to say to keep the mouth open. Notice in your cheeks that there's no compression in them, that it's just loose and just lightly hanging over your face. Same thing for the ears. Imagine the ears dripping down. So even the way we close your eyes, close them softly, lightly. That way the muscles on your forehead and your temples are also at rest. Keep the fingers soft and the toes soft. Imagine a breeze weaving between the fingers and between the toes. Now it's already been 2 minutes, but I do believe you can stay longer because we're still getting into the hips. We want the hips to also let go. Try to relax them. All right. From there now, take those hands to your legs. Draw the navel in to give your hips some support, and then bring those knees together. Lift the head forward, roll the spine slowly. Take your time. Always come out of the pose gently so your lower back doesn't get that shock. And now, take your balls through another way. It's going to go horizontally across the body. And instead of pushing it up against your hips, this time we're going to press it a bit further away. And in fact, right now, if you see my bolster, it's low. I would suggest it being much higher. So in this case, use your blocks, put them underneath. Take that soft padding, and then you're going to lie down again. But what we want in this case is that for the shoulders to touch the ground. So with the help of your feet, you walk it in, you lift the hips, maybe you anchor yourself down with the hands, slowly get the head to the floor, and then get the shoulders to the floor. So just keep maneuvering with the hips. Once the shoulders are down, let's set the timer as well. From there, you're going to lift the legs one after the other and grab the legs if you need to until they're off the floor. And at the moment, we're arching the spine, and that's not what we want. We want to reverse the shape by rounding it. Let the feet fall behind you. It doesn't matter if the legs are together or apart. It should, again, just be a very passive approach of being in the pose. And it's so important that your neck is straight. So if your ponytail is in the way, do remove it. The arms, just like before, have them behind you. And this is one way. This is called snail pose. In some styles of yoga, this is called plow pose. So just allow that relaxation along the backside of your body. The spinal muscles, the hips, the hamstrings. And if your knees happen to be very bent, that's okay for as long as that's the maximum opening that can naturally occur while you're in this position. And if perhaps it will be comfortable for you, it is also a nice way to be in the pose, which is to have the hips much higher. And again, you want to keep it soft, so you keep the knees relaxed. They'll come into a natural bend. No effort in the arms. So we don't want to grab the legs. We just want the arms to drop on the floor. Now, if you do this version where the hips are high and not even on your bolster anymore, make sure that your inhaling is still very intentional. It's the quality and depth of inhale that is healing to you and can support the relaxation of your system. A nice fact about an inversion like this is that it calms the nervous system. The gravity encourages blood flow back to the heart, so the heart doesn't have to pulse as strongly, doesn't have to contract as strongly to get the complete cardiac output. So this kind of position is really recommended at the end of the day when you're close to bedtime. And it can even be done where the legs are straight up towards the ceiling instead of just hanging behind you. Do know that when you're coming into this pose, especially if you're going for the hips very high, that one way that I've seen people do is they grab their hips and they do like this full lift, and that can be quite stressful on the spine, stressful on the whole system. It takes you longer to settle down. So if it's so much of an effort to get your legs over your head, you do the first version where the hips are still in contact or your back is still in contact with your props. And we can come away from it now. So first bend your knees. That way your center of gravity is closer to the hips and you're able to control the release more. Step one foot down. Check how your lower back responds. If there's no pain, then do the other leg. And then just stay there for now, because the spine needs time to adapt. Breathe through it. Check how your neck is feeling. That way, in the future, you know how far you're going to go. And then, as you come out, engage your abdominals. Then wiggle the hips to come down. That's one way to do it. You can also just slowly lift the head, roll the spine, using that abdominal support. And then rise from there. Bring your head down between the legs. Take the deep breath. And then let's release. So that was it. Just those two things. Good recovery postures. The first one, Supta Baddha Konasana, is especially if you're female, you have maybe some period pains. That's really a very ideal position to practice throughout your period or even throughout the month if you know that it's already coming up. So that helps to really relax the pelvic region. Well, there you go. Enjoy. And as you can see, you can probably stay in the postures for much longer than we did here. So you have the concepts at hand and you can apply them to yourself. So enjoy practicing. Remember, everyday practice is the best. That's when you get the results that we're looking for. So see you for the next one and have a great time.